Hi, we are Garnett's algorithm, and we'll be talking about COVID-19 and its effects on the Black and Latinx communities in the DMV area. Hi. Essential personnel seem to be greatly impacted by our current health crisis as they are more exposed to the virus than anyone. According to research, nearly 20% of all workers in Virginia are in the essential industries, and more than a third of the workers are Black. And also, 43% of the Latinx workers in these industries do some kind of work in cleaning services. As these groups seem to be the most vulnerable in our communities, the question must be asked, how have these demographics been impacted by COVID-19? Essential personnel To truly access the issue, we decided to take a look at the communities in the DMV area. We used COVID-19 data from these areas to address the following questions: who is contracting the virus and in what quantities, and who is dying from the virus and how many of them are. To truly A comparison bar graph was made between four groups, comparing the number of cases and deaths in D.C., Maryland, and Virginia. Percentages were then calculated using Excel to compare those numbers proportionate to the population of each area. Research was then further completed to understand the results that we got. When we look at total cases, at first glance, it seems that the white demographic is more impacted by COVID, but that is not the case. In Virginia, for example, white people make up 68% of the population, Black people make up 19%, and Latinx makes up 9%. Despite of this, white people only make up 22% of all COVID cases, while Black people and Latinx make up 18 and 28% respectively. Proportionally, people of color are contracting the virus more than their white counterparts. We can directly correlate this to the percentage in deaths as well. Democratic lawmakers presented a letter to the Health and Human Services stating any attempt to contain COVID-19 in the U.S. will have to address its potential spread in low-income communities of color to protect the lives of those communities, but also to slow the spread of the virus in the country as a whole. We need to ensure the safety of the communities that bring us our frontline workers, or grocery store clerks, or blue-collar folks, so this society and its economy can run as normally as possible. Furthermore, the Commonwealth must assess how successful COVID-19 testing is to everyone. This would include measures such as feasible access to free testing and equal treatment at healthcare facilities. Community members can also ensure the safety of others by following the protocols stated by the CDC. For this, ensuring that these communities are safe will overall flatten the curve of the virus within the state as well as maintaining the economy. And thank you for listening to our